going to read because I don't want to get this wrong. We are opening now the official celebrations of the Gianmarco Moratti Award, the prestigious yearly award set up by the E4Impact Foundation in memory of the Italian entrepreneur Gianmarco Moratti, an inspirational figure. The Gianmarco Moratti Award represents a unique opportunity to leverage on the commitment of Italian and African entrepreneurs in committing to sustainable impact. Now in its sixth edition, the award celebrates businesses which, through innovative models and pragmatic solutions, contribute in a measurable way to achieving one or more of the Sustainable Development Goals of the United Nations, thus proving that they can induce a tangible impact in an economic, environmental and social sustainable way. So that's what we have discussed today. So it's a great pleasure for me to give the floor to Professor Mario Molteni, CEO of E4Impact Foundation, who will explain the importance of the initiative and perhaps more importantly will announce the winners of the 2025 edition. Professor Molteni, over to you.
Questo è un momento speciale.
Thank you very much. This is a very special moment because it's a memorial and an appreciation of a person who's very much loved in this place, but very much loved by the E4Impact Foundation because he backed our initiative right away. We're at the sixth edition. Every edition has a central idea. We have dedicated one to innovation, one to post-COVID, to the response to that dramatic situation, the generation of jobs, the local community answers given. And this year, as Frank Cinque mentioned, this year there are more than 2,000 initiatives in Africa. And I said, take one of the objectives of sustainable development goals of the UN and show us how, with your imprenditorial spirit, you have given an effective answer to this initiative. 53 entrepreneurs came forward. There was an internal commission that selected them, and there was a final event that was coordinated by Angelo Moratti and a jury of 4 experts on the basis of impact and economic sustainability criteria discerned the winner. Now, I've just now explained the mechanism with which we have arrived at the 2 winners of this year. The first is Lawrence Oba, who comes from Zimbabwe, and he chose the theme of access to energy. He's the CEO of a company that furnishes renewable energy, variable solutions for communities and for companies in southern Africa. We'll hear him later. Leonard Bakaika is the second from Uganda. He chose the theme of health, and in fact he's a doctor, founder of a clinic, a medical center that offers accessible quality care in the western area of Uganda, especially giving treatment of diabetes and the effects of diabetes. Now, these are the 2 winners that we are very proud to present this year. They are entrepreneurs that are getting close to the threshold of 1 million in revenues, but we think that there's a space also for people to lead them to a next level, to a new quality level as well, because this is the objective that we have given ourselves as a foundation in the near future. So I'd like to ask the 2 winners, please, to come up and take the floor.
Qui c'è sempre l'emozione.
Here we always have the technological the wait for the technology to click in.
Amico ugandese.
We'll start with our Uganda friend, Fred from Uganda.
Please, Leonard, please.
Yes, Thank you very much for the opportunity. I am Dr. Leonard Bakahika, a medical doctor from Uganda. I started a business called Ebenezer Clinic and Diagnostic Center, where a childhood promise was made to ensure that no family loses a loved one to a preventable disease. My father was a health worker in Ibanda, which is in the southwestern part of Uganda, and he used to move miles in tattered boots, treating malaria-stricken children, expectant mothers, and the elderly in the community. But at 33, at a tender age of 33, undiagnosed, untreated, hypertension took him away from us. The nearest clinic was too far and the care too late. I was 9 years of age and my brother Eugene was 3. And standing by his grave beneath a mango tree, that day we made a promise, or I made a promise. No family should lose a loved one to preventable disease. But promises are easy, fulfilling them takes everything. To honor my promise, after medical school in Bara University of Science and Technology, I worked in Iraq, coaching deserts alongside American soldiers, saving every dollar for 8 months. Then, with my brother Eugene, we braved South Sudan's war zone for 5 years, stitching wounds amidst gunfire. We went where the need was greatest, where lives hung in the balance to build the future we had promised, one family at a time. In 2015, indeed, we returned and opened the Ebenezer Clinic, and it wasn't much. It was just a small room with a stethoscope and a second-hand exam table and a dream. And the dream was ours, built on the same soil our father once walked. Today, Ebenezer Clinic has served over 50,000 people. But what we are dealing with is staggering. The crisis is staggering because every 2 seconds, someone aged 30 to 70 years, a mother, a father dies from a non-communicable disease globally. In Uganda, it's even worse. 1 in 4 adults battles hypertension, half unaware. Diabetes has surged and it has doubled to 1.4 million in the last decade, yet 72% of rural Ugandans have no access to care, with the bulk of specialists located in the city and the regional referrals. Over 40% of Ugandans walk past 5 kilometers to the nearest health facility, paying out of pocket, selling their last goat, their only form of livelihood, just to afford a doctor's visit. With one doctor every 11,000 people, far from World Health Organization's target of 1 per 1,000 people, the system is crumbling, and we couldn't just sit by, we had to act. So at Ebenezer Clinic, we started to fight NCDs with innovative and community-driven solutions. We have a wellness center where at $13 a visit, you're able to achieve a checkup, a doctor's consultation, medications for a month, exercise and nutrition workshops. And with this, we have been able to empower thousands to manage hypertension and diabetes, fostering social sustainability. We have not stopped there. We have added mobile clinics, reaching remote villages and refugee camps. We deliver care and restore hope, one smile at a time. We also started Kelvin Pharmacy that dispenses 3,000 discounted prescriptions monthly, ensuring no one has to choose between food and medicine. With partnership with Professor Angela Wells, we started the Smart Pills app, which enables 200 diabetes patients to monitor their blood glucose offline, sharing results with the health worker, and in turn they receive medications, keeping them healthy without missing a day's work. We have also, in terms of impact, we are transforming lives one story at a time. Since 2015, Ebenezer has grown from 50 patients who are seeing to 50,000 patients, becoming a movement for health and hope in Uganda. We are tackling the Sustainable Development Goal number 3 with 5,000 lives touched every year through our clinics, pharmacies, mobile clinics, and delivering care to the most vulnerable. But we haven't stopped there. 1,500 learners listen to me every week at 10 a.m. on Iraka FM, where they gain knowledge on healthy living and entrepreneurship. Actually, through that initiative, I've been able to write a book, Beyond the Stethoscope, A Doctor's Guide to Financial Freedom, set to come out in June 2025, which will empower 1,700 doctors in the Uganda Medical Association circle, which I'm part of. We have also given access to 300 women with family planning services at less than $1 a year last year, fostering choice and dignity. 100 jobs created through doctors, nurses, drivers, vendors, fueling our local economy. We are also partnering with AKVO or AKVO, where we are bringing safe water to 1,000 people, enhancing health and hygiene. Each number you hear is a story. A mother who will see her child grow, a father who won't live too soon. Our dream is to have 100 solar-powered kiosks or self-testing machines in every urban center in Uganda, with charging hubs powered by solar, which can be able to charge phones, motorcycles, and in future cars. We hope to have 15 wellness center clinics, starting with one that we've already started in partnership with Rotary Uganda to deliver affordable healthcare to our people. We hope to have 10 mobile clinics, a fleet of vans stocked with medicines, doctors, and dreams, reaching the most remote corners of this country, ensuring care for all. Together, we'll transform lives one community at a time. To Dr. Moratti, Letizia, Professor Molteni, the If for Impact Foundation and its partners, thank you for igniting hope across Africa with your transformative MBA, empowering entrepreneurs like me to dream boldly and act purposefully. To my incredible team at Ebenezer Clinic and every family who believes in our mission, your trust fuels our resolve. My father's vision was a world where no one is left behind and where care is universal. At our social enterprise, we carry this dream forward, striving a Uganda where there is access to healthcare that is a right, not a privilege, where quality education through our education programs unlocks potential, and where dignified jobs and green initiatives pave way for a sustainable and equitable future. Together, we are not just building a better Uganda, we are weaving a tapestry of hope for the world. Let's continue to innovate, collaborate, transform lives, leaving no one behind. Thank you for listening to me.
Thank you very much, Leonard.
Thank you. The other? Maybe?
Good afternoon.
Yes.
Ladies and
Please,
gentlemen,
Lawrence.
my name is Lawrence. I'm the founder and CEO of Enra Power, a renewable energy company that is based in Zimbabwe. We also have operations.
Non vediamo, ma non so se c'è qualcuno in regia che c'è.
Fortunately, the video is not working. I'm wondering whether someone can maybe help out, re-establish the connection.
Yeah,
Go ahead.
please,
The floor is yours.
quickly, Lawrence.
Good
thank
afternoon,
you.
ladies and gentlemen. My name is Lawrence Hova, the founder and CEO of Enra Power, a renewable energy business that is based in Zimbabwe. We have operations in Zimbabwe and Zambia and South Africa. My apologies. It seems like there's something with.
We can hear you. And also
you can hear me,
yes,
right?
yes, go ahead. Thank you.
Oh, thank you. So Enra Power started in Zimbabwe in 2014. What caused us to start Enra Power is there was a severe challenge with access to energy. We had started having load shedding of about 16 hours a day, which meant that no one would be productive most of the day, as the grid would be switched off at around 4 a.m. and then come back, be switched on again at about 10 p.m. Or sometimes even later, meaning most businesses either had to switch to working at night, or they just would have to resort to using generators. We then looked at what else could be used, because generators were not sustainable for everyone, and they were costly. They were resulting in large fumes in industrial areas and in also residential areas. That was when we realized that solar could be an option, and other renewable options also could be a solution. So our vision, really, our mission is to create impact in low-income communities in Africa through the provision of affordable and reliable, sustainable energy solutions. And then we work to provide quality, affordable, and reliable renewable energy solutions to communities and commercial entities. What we do is we are operating in Zimbabwe, Zambia, and South Africa, and we want to lead Africa's transition to sustainable energy for all. Because what you realize is that energy in Africa, energy poverty is prevalent in Africa. It affects households, it affects farmers, it affects communities, it affects health centers, and it affects commercial and business clients, as well as affecting all nations. So this is the situation that you have in most of Africa, where increasingly there's more dark days than there are light days, because most countries have relied on coal for power generation, and increasingly there's no financing for those coal power plants. And also some countries have relied on hydro, and the rainfall patterns have been affected by climate change. And this is what's causing the situation. And if you can just picture this, children have to study using kerosene lamps. Women have to travel long distances to try and gather firewood for cooking, or also have to resort to selling firewood so that other people can have energy. So we have been tackling the growing energy access gap since 2015, using basic solar lights and solar equipment distribution. We also do installations of solar systems for productive use, and then we offer commercial and industrial solar solutions. We have a team, a technical team, and we have also a distribution team. Our community distribution team is well over 300. And we also have a technical team made up of engineers. What we have managed to do over the years is we have created over 300 direct jobs, and we have also created about 1,500 indirect jobs. We have increased farming and household productivity and income for various households and farmers. We've also improved business productivity times, because most businesses can now work during the day from the energy we would have given them access to. There's also better access to lighting and cold chain facilities for farming, education and health centers, and then access to clean water. The impact has been reduced greenhouse gas emissions and reduced deforestation. In terms of numbers, what have we done? We've distributed standalone solar systems more than 1,200 kilowatts, which is more than 1.2 megawatts in standalone solar systems. We have also done more than 250 systems for water pumping. We have distributed over 1,500 solar home systems. We've also done clean cook stoves, over 650 and over 50,000 basic landings. And the numbers that these are impacting are well over 200,000 in terms of the numbers, because you find that each system benefits about 6 people for use. Just as an example, we have solarized schools, we have solarized rural homes, we have solarized clinics, and we have solarized various places. Our impact has been measured by SEED, which is a UN Sustainable Development Organization. And where are we looking at going? We are looking at increasing our access for renewable energy for our communities. We are looking at growing our operations in Zambia and South Africa. We are developing a solar farm, which is at feasibility stage. We are also setting up 10 by 100 kilowatt solar power plants at schools and health centers with some Italian partners. And in the future, we are looking at growing the portfolio of solar power plants. And why are we saying this? We are saying this because we know that within the audience, within this great audience, there may be people that are looking at investing within the solar space, within the renewable energy space in Africa. We are your partners. We know this space well. We have been working in it for more than 7 years. We know the ins and outs. We know the technology, and we are ready to partner you, any of you that may be willing to work with us, especially Italian organizations. We are already working with some Italian organizations, but though on a corporate social responsibility project. And lastly, I would like to thank E4 Impact, the Gian Moratti Award organizers and attendees of this event. With this award, we are looking forward to greater impact for us. We are looking forward to greater marketing opportunities. We are looking forward to greater connections with Italian companies, with individuals who are willing to work in Africa, who are willing to come and help us make an impact, and together we can make an impact. We can change the lives of millions of people who lack access to a reliable, to a reliable energy access. And this number keeps growing as the population grows, and there is little or no activity happening in terms of alleviating this. We once again would like to thank you and appreciate the award and appreciate the time we have been given to present. Thank you.
Thank you very much.
Thank you very
Lawrence.
much, Lawrence.
Thank you.